Okay, friends, welcome officially to the episode number 12 of 26 episode that we have planned to take on Miraculous Mondays or Management Mondays. So today is Monday, 21st March 2022, 8:15, 20 p.m. That is the standard time. Of course, late by a couple of minutes today. Apologize for that. But yes, today is almost the second, you can say, anniversary of the first COVID lockdown. So we had a Janta curfew on 22nd of March 2020. And from there, the advent of Corona in India began. How good, how bad, we all know it had been, has been. Let's divulge on various aspects which have taken a backseat in today's time. So, friends, as usual, all my presentations will always begin with thanking the Lord Almighty has given me much more than what I deserve. And this is my brief CV. Gives me a little bit of authorization in this regard that I've done my specialization in medical law and ethics from one of the topmost law schools of India, National Law School of India, University, Bangalore. So it is one institute I'll remember, or I would say never forget in my lifetime, courtesy the toughest exams they hold and the enormous amount of library they have. And that is itself in itself a boon for all the students. So yes, these were the WhatsApp groups what I was mentioning where I have been putting up the queries for that. Many of you participated, many of you did not. But then this is for all of you, those who would be watching today. So this is the topic for today. Dental clinic told to refund rupees 50,000 to the patient. By the face of it, I would say the news is itself not complete. But still, let's see what exactly this news holds. A district consumer firm has directed a clinic to return rupees 50,000 as well as pay 25 compensation and 20,000 punitive damages. This by not resolving issues despite giving a warranty, plus 10,000 of litigation costs. Not mentioned here litigation, but that is the cost over there. So 50 plus 45 plus 10, close to 1.5 lakh rupees. Okay, then the complainant names a so and so clinic underwent a root canal and related treatment, which all cost him rupees 50,000. But in 4 days, the treatment failed. This is in itself a very fast thing. You cannot actually make out how and what treatment does fail in 4 days. And why does the dentist will not make an attempt to correct it? But then again, the fishy thing, the second attempt also did not work as per the doctor's advice. And so when he came there to visit, he was stopped and told to contact him over phone. And as usual, the calls will go unanswered and the problem left unresolved. Now, obviously, we all can relate to it that sometimes these stories are cooked by media. A lot of that is cooked by media. We don't know the other side. So we have a common tendency to believe whatever the newspaper says. It is a common tendency to believe the patient and not our colleague, especially when it comes to medical legal matters. Anyways, the consumer forum refused to accept the written version of clinic in the form of a letter as it did not have any seal of the commission. It is suspected that the said document is inserted not at the appropriate time and copy of the same was not served to the other side. Of course, I'll discuss these matters in the presentation itself. These are just legal trivial pretenses which the courts, you can say, put up, and these can always be appealed against. But then let's not drag over you can say, drive away from the major point. Then the bench noticed that the complainant who was suffering from pain was prevented from meeting the doctor when he visited the clinic. So what are the charges? The charges are receiving payment, providing treatment first time, preventing the complainant from consulting the doctor despite issuance of warranty card, certainly amounts to deficiency in service and unfair trade practices for which the opposite party is held liable. Of course, I can ignore all these things for a moment that they have been cooked or maybe overcooked by the media. But this may be the portion which is in commas is surely the part of the judgment that may have been extracted from the right judgment. So many colleagues asked me this question, sir, what could have been done differently? He gave his defense. Of course, it was not accepted by the court. He may have taken a consent, may not have taken a consent. He may have given the warranty card, but when it is wrong to give warranty cards. I'm here to settle all the issues. Today's session is not going to take 15-20 minutes. It's going to take good 30-35 minutes. So if you are doing something else, either you can say stop that work and come to this session, stop multitasking and try to understand what I have to say. But if you are too busy in any other important work, you can skip this session. Of course, it is not for you. So there are 4 factors involved in this that I'll be taking up. In the first 2 in depth and the third and fourth in little much brief part. The number 1 part is the consent factor. The number 2, the warranty and the guarantee issue. Number 3, not resolving patient's issues. And number 4, the seal of the commission and the copy not served matter. These are the 4 parts which have been mentioned in the judgment. So we have to take all these parts into consideration. Let me take that all one by one. Even to majority of dentists today, I would say more than 70%. Consent means, sir, uska kya matlab? Consent kya hota hai? It is like that, which is a very, very strange factor, which is a very, very strange thing. People still don't know the meaning of consent. Consent literally means to give a permission to touch in medical terminology, to touch the patient. Yes, people take in, you can say consent for checkup also. That is not needed. If the patient has walked himself or herself through the door, then an implied consent for checkup has already been done. You don't need a consent for checkup there. I'm not saying it. The court has these things already in black and blue in the rule book. Then the second part in that is, sir, we take a consent immediately on patient's arrival. What is that consent? I hereby give my consent to Dr. So and so to undergo the dental treatment, and I will not hold him responsible for any kind of damage that happens to me. That's it. And that too also on the prescription pad. It is in the printed format or in a stamped format. I used to have a similar one in my college, but I'm talking of the early 90s. Early 90s. We are in 2020s. 30 years minimum in that regard. So we need to take this, 30 years only, close to 30 years. So we need to take into account that consent means doing the thing with the patient's permission. And there is more to that also. Let's divulge that factor. The problem is for the lay dentist, consent means stupidity. पागल हो क्या? पेशेंट को बताओगे उसे ये कर रहा है, उसे ये कर रहा है, ऐसे हो जाएगा, तुम्हारे को वैसा हो जाएगा, पेशेंट तो भाग जाएगा. To tell you a fact, those people who have this mentality, जो ले रहे हैं वो बेवकूफ तो है नहीं. And they're getting results also. You may face an occasional, you can say, a revolt if you have not been taking it, but it does not mean that this thing is not valid. आप में से कभी ना कभी किसी ना किसी को हॉस्पिटल जाना पड़ा होगा पूरी लाइफ में अब तक. रिमेंबर, कुछ भी आपने प्रोसीजर किया तो आपने कंसेंट साइन किया, साइन आपने ब्लैंक फॉर्म किया है, वो भर लेते हैं बाद में. बट इट इज अ ट्रिकी सिचुएशन, इट इज अ स्टिकी सिचुएशन इन दैट रिगार्ड दैट वी नेवर इवन आस्क, इसमें भर के दो मुझे, इसमें क्या लिखा है. वी नेवर इवन रीड दैट. एंड इफ वी रीड दैट, द हॉस्पिटल सेज प्लीज अपने पेशेंट को कहीं और ले जाओ. एंड वी आर इन सच अ सूप, नहीं, फटाफट दो साइन. And everything is done on blank pages. But when it comes to dental clinic, people believe consent is stupidity. Why? Because they don't know it. Lack of knowledge or lack of, you can say it is an ignorant thing. Ignorance is not always a bliss. You need to understand that part vehemently. If you are not taking consent, you are putting yourself in danger every day. You are becoming a rowdy rathor every day. Living life on the edge. So remember that. Now, what is the problem? The problem is the real difference is in the expectations we set. लोगों को ये लगता है, बहुत लोगों को, more of paperwork means less of clinical work. सारा दिन ये कागजी काम करते रहेंगे तो क्लिनिक का काम कब करेंगे? So the simple way out is a blanket consent. I authorize Dr. So and so, and I will not hold him accountable. This is BS. Bullshit. Sorry for my language, but this is bullshit. This does not hold any ground in any court of law. You don't get the permission to, you can say, damage the patient's organs. In this case, teeth. In this case, soft tissues. In this case, other muscular or any bony damages. वो तसल्ली मन की होती है सिर्फ, कम से कम कुछ तो है ना अपने पास, पेशेंट ने साइन किए थे. बहुत लोगों के प्रिस्क्रिप्शन पैड के ऊपर होता है. प्रिस्क्रिप्शन पैड कहाँ होता है? Goes with the patient. What is the end result? End result is Than Gopal. We have nothing in hand. So as I said, consent literally means the permission to touch. But it is not the only thing. This is the common thought process. जिनको नहीं पता, जिनको पता होता है कि हाँ consent होता क्या है, उनके लिए touch, पेशेंट को हाथ नहीं लगाना. जिनके लिए नहीं पता उनको वो तो consent होता क्या है सर? As I told you in a couple of slides back, consent is much multiple times repeated intentionally. More than that. What exactly is that? It means you and the patient are on the same page, same thoughts, and both of you are clear about the end results. And in bargain, you set the expectations so that there are no surprises. डॉक्टर इसके बारे में तो पहले आपने मुझे स्टार्ट में बताया ही नहीं है. नहीं, ये तो मेरे हस्बैंड को पसंद नहीं आने वाला. आई एम सॉरी, ये तो आपने मेरा काम खराब कर दिया है. It takes only a minute for the patient to react, and then that can blow out of proportion. Because many things done in good faith backfire. Then it also means that the patient is aware of the consequences of the side effects of the treatment. The unfortunate problem in Indian mentality of dentists. I'm sorry to use that word. I'm also an Indian. I'm also a dentist, but this is the unfortunate problem with those 70-75% is they believe consent is also about that. दांत निकाला तो आपकी हड्डी टूट जाएगी. पेशेंट को ऐसे बताओगे तो दांत कौन निकलवाएगा? रूट कैनाल कराई तो आपको पैरेस्थीसिया हो जाएगा. अकल जाट निकलवाई तो आपको वहां पे पैरेस्थीसिया हो जाएगा. रूट कैनाल करवाई तो आपको ये हो जाएगा, वो हो जाएगा. Whatever, all those things, all those misnomers. We believe consent means only this. Consent is much more than this. Then many people waste their time on the consent form. Waste the time means in terms of the how of the procedure. Every tooth has 3 layers, enamel, dentine, pulp. When we have the cavity in the first 2 layers, we fill it and all that blah 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 blah. Root canal is about entering into the pulp. They detail the half of the Grossman in those 2-3 pages. And then they say, मेरा तो सर consent page 5 पेज का बन जाता है. It is very cumbersome. मैंने तो एक बना के रख लिया permanent. To tell you a shocking fact to majority of you, those who don't know, consent is never fixed. It is always a customized form. Always after a consent session, I get this one request. Sir, please अपने consent form भेजिए ना. And when I reply back, sorry, I don't have a consent form. Sir, आप मजाक कर रहे हैं, आप देना नहीं चाहते. ठीक है, you can think that way. That is a fact. I have the templates of the consent form and I make the consent form there and then according to the patient, wherever needed. Not every case would require a written consent. Not every case would require a written consent. Many would be a express or a verbal consent as well. Then the consent also means the patient is aware of the total costing of the treatment. How many of you actually mentioned the costing in your consent, those of you are taking? No. Then you have problem payment issues in the end. Then you say patient dhaga kar gaya, patient aajkal ke nikamme hain, pehle advance payment karao. It's not mandatory to have an advance payment. Advance payment puts you more under pressure in that regard. Take it in phases. That also means that you should know which phase how much to get. It is your discretion. आपने 2000 का रूट कनाल फॉर एग्जांपल करते हो तो आपने फर्स्ट सिटिंग में रूट कनाल किया तो आप 3000 ले लो. इफ यू आर डूइंग द होलिस्टिक ट्रीटमेंट और द होल ट्रीटमेंट, क्या आपका फुल माउथ करना है या एटलीस्ट पार्शियल माउथ करना है, इसमें मल्टीपल रूट कनाल्स, मे बी कपल ऑफ एक्सट्रैक्शंस, ब्रिजेस, कपल ऑफ इम्प्लांट्स, 8 restoration, all that thing. If you are doing that, you can do that in phases. But if you have done a root canal, don't charge 2000, you can charge 3000. Said I'm taking the payment in phases. This is in a way to make sure that your payment finishes in second last, third last, fourth last sitting. But then you need to be very, very sure of your treatment plan. Your sequence of the treatment plan made first in head, written on paper, slept over it, conveyed to the patient, be on the same page, and then sign the same thing. Consent is not about the paperwork. Consent is more about the mental thing. You have to convey all that thing mentally first, verbally first, so that the patient knows. When the patient is seemingly acceptable to your treatment plan, then the consent becomes just a procedural formality. जो मैंने आपको बताया वही पेपर में आप पढ़ सकते हैं. You need a witness also, and we sign it. That's it. The problem is वो बम गिरा देते हैं. ये लो जायदाद के कागजात, इस पे साइन कर दो, तुम्हारी सारी जायदाद आज से मेरी. It is thrown in the patient in the front of patient like that. It's not. Patient की जायदाद नहीं नाम लगवानी आपने. That was on the light side. Don't take it seriously. So it also means the do's and the don'ts of the treatment, the instructions. We don't know how to throw the ball in the patient's court. This is the problem. Then it also means that the patient is aware of the longevity of the treatment. The problem is longevity is confused with warranty and guarantee. The moment we see the patient not getting convinced by whatever you say, आंटी जी बंदे की गारंटी नहीं, आप मेरे से दांत की गारंटी मांग रहे हो, कोई गारंटी नहीं. Somebody who's spending a bomb requires some assurance. And some colleagues do this ways, become a James Bond. Some become a Masiha or a Robin Hood. They'll say, आप चिंता करो, मैं बैठा ना, मैं हूं ना, मैं कर लूंगा, मैं हूं ना, चिंता ना करो. 10-15 साल तो कहीं नहीं जाती, मैं आपको बता रहा हूं. And if the same treatment fails in 3 days, 4 days, 5 days, or 3 years, 4 years, 5 years, the patient has a breach of trust with you. बातें बड़ी बड़ी थी, 15 साल 10 साल बोलता था, 1 साल में 2 साल में फेल. You lose a old retentive patient. So this is all what you will cover in the consent form. You will never ever, you can say, confuse the longevity with the guarantee, and just you can say the side effects means the consent, or the how means the consent. In my consent form, the how is covered in 2 lines. I know how a root canal procedure is done, and I have been made aware of the same by Dr. So-and-so, Dr. Ahuja in this case, me for example, by showing various visual and audio aids like PowerPoint videos, etc. 2 lines, or rather 1 extended line, and the how is done and dusted. Your total consent form, including all this, जो आप लोग नहीं कर रहे थे आज तक, will not need more than 2 pages. Ask any of my participant who has done a consent workshop with me. Rarely it goes on the 3rd page, including all this. Now the second factor, बहुत पेचीदा issue, burning issue, and some people have attained nirvana in that also issue. I would say warranty, 5 years, guarantee, 100% guarantee. What is the difference between these 2 things? We all know it. Warranty, guarantee. Let's take that up. Let's take that part up. So let us suppose you gave a guarantee or a warranty. आंटी चिंता ना करो, मैं बैठा हूं, चलेगा 10 साल 15, कहीं नहीं जाने वाला. What is the proof with you? Let us suppose you did not give a guarantee or a warranty verbally. Then also, what is the proof with you? The patient files a case that the doctor had promised me 10 years. How will you negate that? So the consent has to be in that regard. So इधर कुआं उधर खाई, फंस गया रे ओबामा. Remember this. There is no way out sometimes. So the better word to use in this situation is the longevity. Nobody discusses that. We have a belief in giving the numbers blindly. 8-10 साल 15 साल कहीं नहीं जाने वाला, 2 साल 4 साल. Do you say to the patient, ये आपकी फीलिंग तो 3 दिन चलेगी? You won't say it. नहीं चल जाएगा, लंबा चल जाएगा. फिर भी डॉक्टर साहब कितनी देर? 4-5 साल तो चली जाती. You don't give it numbers. And then if something happens before that 4 to 5 years, आपने बोला था 4-5 साल चलेगा. That means your assurance was for 4 and 5 years. Or some of us then become cardiologists or heart specialists. Heart surgeon कोई guarantee देता है heart की? Please take a life, get a life. You are a graduate, even a postgraduate, comparing yourself to a super specialist. with an organ जिसके ना होने से इंसान नहीं रहता है, दांत ना होने से इंसान मरता नहीं. Please stop giving this nonsense excuse in future. Heart surgeon doesn't give. There is no comparison. There is no comparison at all. So don't give that excuse to yourself. Or then even better, people become spiritual. सब मोह माया है, इंसान की कोई गारंटी नहीं है, तो हमारी क्या गारंटी है? सब चल जाएगा. We don't believe in throwing the ball in our court philosophy. Doctor, how much it is going to last? The simplest answer can be, if you maintain well, maybe 5 to 6 years. Maybe. It is mentioned in your consent already. If you don't, not in 5-6 days. I remember one of my friends in Australia came for a reunion, you can say 3-4 years back. He said, patients come to us and say, Doctor, आपने feeling करी थी, of course they say in English, I'm just translating it for you. आपने करी थी, शायद मैंने कुछ खा लिया होगा, मेरी feeling निकल गई. And here it is reverse. The patients will say, Doctor, अभी 2 महीने पहले तो करवाई थी feeling, अभी निकल गई. He said, यार 2 महीने तो नहीं यार, आपको ज्यादा टाइम हो गया. Then you search the record, sometimes it turns out to be 2 years. So patients are also smart. Don't ignore their smartness in this regard. Not every patient will try their luck and genuineness sometimes. You need to remember. Then the bigger problem associated with this, somebody who spends money needs you to be accountable. कुछ तो पता चले ना. अगर बोले नहीं मेरे तो कोई गारंटी नहीं देनी है, कराना कराओ नहीं तो जाओ. They have so many options around you. They'll go and search. But that doesn't mean that you go on giving a blind warranty. Simply saying that we believe that we do our work best and you have to trust us. For that, you have to build up your reputation first in that area, that your work really lasts long. If you're a newcomer or into the stable, or you can say the starter phase or the survivor phase, 0 to 3, 0 to 5 years, you cannot do such things. You cannot really make the patient believe in you. We need to remember that every patient is not the same. Many will need a mental security. Aap hona is a good enough security, but aap hona at a charge is something else. There is nothing wrong in that. Dental treatment is costly, and anyone spending a bomb would ever make sure that whether he is in the right place or not. Remember, we have all of us, all the patients rather, would have so many options around them. So we need to make sure that these things are taken care of. But then many of us have the God syndrome. डॉक्टर भगवान के बराबर होता था. 1986 में जब कंज्यूमर प्रोटेक्शन एक्ट आया, हम गॉड नहीं रहे. गॉड को भी घसीटने लगा गया कंज्यूमर कोर्ट में. अभी 1-1.5 साल पहले बहुत लोगों ने कंज्यूमर कोर्ट एक्ट इज एस्टैब्लिश्ड, इज अबॉलिश्ड, जब बहुत हो गया, राज्यसभा पास दिस. रिमेंबर द व्हाट्सएप यूनिवर्सिटी वाज गोइंग गागा ओवर दैट व्हाट्सएप फॉरवर्ड just a couple of years back, or maybe 1.5 years back, if I remember correctly. But then this is the problem. When these kind of things happen, then they say, oh, to बेवकूफ था, WhatsApp University का झूठा forward था. This is the way things happen. So we need to remember that we have to get rid of our God syndrome. So warranty means the confirming the longevity of the procedure in patient language. How much patient does want. Promising n number of years is actually wrong. You claim 5 and comes out 5 years and comes out in 5 months, any restoration, anything. That is actually breach of trust for the patient. Breach of trust के लिए भी section IPC में है. Of course, इसमें वो चीज नहीं होती है. We are not under section 307, which is IPC, section IPC is breach of trust. उसमें हमारे पे नहीं आता है, no doubt. But मेरे लिए ये breach of trust होता है. You claim something and it, you can say, comes out in a different way. Even I don't give any kind of longevity or warranty for any of the procedures. But yes, I do pass on the lab warranty. What I get from the lab, I do pass it on. I'll tell you how. I'll tell you the how. Just one example I'll give surely. I'd rather believe इस चीज को सोच के देखिए. For lab work, you should be thankful that somebody is willing to cover up the damage for some years. Bridges, any crowns are not cheaper. Maybe it may be cheaper for you, but not for the patient overall. So nobody says if you pass on the warranty, you don't give the card and all that. You have all the right to settle the warranty terms and conditions. Lab repeats it to you for free. You can settle your own conditions yourself. I'll give you a demo, don't worry. But conveying the same is important, and nothing better than a consent form. जिसमें सारी चीजें cover होंगी. Throwing the ball in another court, I gave the example. That is also covered. Because consent is one of the important documents of your clinic. Unfortunately, it is missing in 70 to 75% of clinics. और जो 20-25 में हो रहा है उसमें भी fully नहीं हो रहा है. उसमें भी बहुत सारों में blanket हो रहा है. जो बहुत सारे blanket कर रहे हैं, remember this is not valid. So like for example, I'm going to show you one of the templates that I use in my consent workshops. The crown and bridge workshop, the consent workshop, I mean. So I'll just be showing you crown and bridge, the portion of that. Remember one thing, lab warranty has the potential to absolve you of your misdoings. आपने clearance नहीं दिया, आपका crown chip कर गया, so you have the chance to get the crown repeated, and you can say cover up your mistake. But believe me, warranty or any kind of longevity or any kind of even consent will not absolve you of any negligence though. And communication in black and blue is very important. And that is where the consent form stands out. So let me give you the demo of warranty. How you need to document or add an insert of that in your crown and bridge. You can take a template of that. You can say copy that snapshot, whatever you want to use it in your, you can say if you are giving warranty. This should be a part of your consent form. Some labs may give, you want to pass it on or not, it is yourself. It is your choice. I do it, but I do it with some T&C. Because I have found those things to be a practice builder. हर चीज के फायदे होते हैं, हर चीज के नुकसान थोड़ा ना होते हैं. लॉकडाउन ने लोगों का बिजनेस बर्बाद कर दिया, लॉकडाउन ने ये कर दिया. Lockdown gave birth to this online education industry, and it is not going to go away. It is going to stay parallel with this offline industry. And trust me, people like me who are in tier 2 city, who don't have a direct airport connectivity, I'm happy to do my workshops online. Rather than traveling every alternate weekend, staying away from the family. I'm happy to do all this online. So everything has a positive effect. So use the warranty to a positive effect rather than using it or thinking outrightly yourself as a cardiac surgeon or a cardiac specialist, I mean. So the metal or the metal with ceramic or whatever cap you're using, you can use that. Don't blatantly copy it. जो आपका crown है उसमें ये चीज use कीजिए. Monolith zirconia or layered zirconia or whatever. is covered. कितना आपको cover कर रही है 1 2 3 4 5 10 15 whatever. इनमें से एक, choose only one out of this. Again, इसमें से भी choose only one, whatever your lab gives, and mention from lab only and not from you. Mention that very clearly. The warranty is from the lab, from the date of insertion. You may allow a contingency time. 1 महीना plus minus is allowed. You can say giving an extra cushion to the patient sometimes. Then of course the riders associated with it in that regard, if I may say that presence of warranty card is essential, presence of the processes is essential. Apart from that, what all needs to be added? The caps, or of course it has to be in patient language, which I teach in the workshop. Of course, it doesn't have to be a technical language. Have been pasted. I'm mentioning cemented also in side-by-side bracket with a permanent cement or a resin, which has an average life of 1 to 3 years. However, it can be more or less depending upon your maintenance. Repasting, cementation or bonding, whatever you're doing, of caps. Again, choose only one option which is applicable, is not covered under the warranty clause, and can happen sooner or later than the average period mentioned. And the charges will be extra at rupees every single time that happens. Very important word. इसी को मत लिख दीजिएगा, very important words भी वहाँ पे. This is the way you have to, you can say. Then all fractures with or without ceramic, whichever it is, any fault will be repaired, replaced in the above specified time period. The repair is free if the same is dislodged. Again, it is a discretion. You can modify these. This is not the cut, copy and paste thing. Modify these as per your discretion, whatever you want to settle. The only thing is, if you are mentioning it in consent form, it should be conveyed. As I said, the consent is first verbal, then it is in black and blue. Sorry. So, however, if the same is not dislodged and develops a problem, bridge laga hua hai, fix hai, chip ho gaya, lekin the same will be removed as per patient's consent and sent for repair or replacement. The liability would be subject to the cost prevailing at that time. The maximum liability can be 10%, 15%, whatever you want to. You can put in your price कि total जो cost है उसका 10 लगेगा, 15, 20 लगेगा. You set your own terms and conditions. Otherwise, for any of the repair or replacement cases, pasting or cementation or charges will be extra. When you add these sorts of clauses along with your warranty thing, how are you going to face a problem in this regard? The only problem you can face is when you don't attend the patient. हम attend इसलिए नहीं करते हैं या free में करना पड़ेगा. When you have all these things covering up for your chair side time, देखिए मेरा logic is very simple. I don't earn twice from the same patient. I don't earn the same profit from the twice from the patient for the same work. If I have done a work, it has chipped, the lab is doing it free of cost. I charge this much amount which covers for my chair side time or my material or whatever. It doesn't give me profit, of course, but I don't want a profit. It is my mistake, which has been thankfully covered by the lab. People don't understand this thing. और बन जाते हैं cardiac specialist. Try to have that mindset from me at least tonight, those of you are watching. Then the third was not resolving the patient issues. Phone नहीं उठाया, phone नहीं pick किया, calls went unanswered. So not resolving patient issues is a grave mistake. I would say rather inhuman. मैं तो हमेशा से मानता हूं बद्दुओं में ज्यादा ताकत होती है एक दुआ से. So किसी की बद्दुआएं मत लीजिए. Somebody is in distress और हमें लगता है बार बार बिना बात के ट्रबल कर रहा है, बिना बात के तंग कर रहा है, दिमाग चाट रहा है. वो इतना फ्री आज के डेट में कोई नहीं है, कोई भी नहीं है. किसी कोई आपके पास आ रहा है, इमेजिन हिज सिचुएशन, ट्राई टू बी इन दैट पेशेंट्स शूज. कहां से आया, कब से आया, बिना अपॉइंटमेंट के आया, जिस तरह भी आया, try to at least attend to him and talk to him. Somebody has paid you. मैं तो हमेशा से मानता हूं आपकी इनकम, आपकी सैलरी, whatever you are earning in your clinic, patient is the next person after God who is giving you this. If you understand this point, you will never disregard your patient. He is responsible for the social status that you are maintaining in your personal life. He is your bread earner. He is your bread. He is a feeder for you. You need to remember it. हम सब पागल हो जाते हैं, नया पेशेंट, न्यू पेशेंट आए. अरे अगर आपके क्लिनिक का एक सेट पैटर्न है, कोई एसओपीज है, उस नए पेशेंट को आपके नए सिस्टम में ढलते हुए थोड़ा टाइम लगेगा. ये डॉक्टर ऐसे काम करता है, ऐसे बुलाता है, ऐसे पेमेंट लेता है, ऐसे. ओल्ड पेशेंट को आपका सारा सिस्टम पता है. ही इज योर हैप्पी, सेटिस्फाइड, लॉयल पेशेंट. If you ignore him, you're losing a retentive patient. People ignore, people always look out for new patient नहीं आता. Old कितने retain होते हैं? That part I take up in my PG analysis part. Practice growth analysis, one-to-one sessions that I do separately. So you need to understand, losing a retained patient will, you can say, make you lose more than losing a new patient. वो उस पूरे साइकिल को अडेप्ट करते हैं, आप पे बहुत टाइम लगेगा. ओल्ड पेशेंट को आपका सारा सिस्टम पता है. ओल्ड पेशेंट को आपको पता है कि आप कंसेंट लेते हो, उसको 1 मिनट नहीं लगाना साइन करना. पुराना फॉर्म लगा के उसमें सिर्फ टूथ नंबर चेंज कर दो, चलो हो गया. कोई सेटिंग नहीं, कोई कंसल्टेशन नहीं. दिस इज हाउ वी वर्क. वी डोंट रिलाई ऑन न्यू पेशेंट. ओल्ड पेशेंट का टाइम कहाँ लगता है? ऑलरेडी कंसेंट फॉर्म है, निकाला प्रिंट आउट, उसमें टूथ नंबर चेंज किया, कहानी खत्म. दिस इज द वे यू हैव. रिमेंबर, आई एम इनटू 23rd year of my practice. Some of you may be into much less. So you may not be having that number of patients in that regard. I mean the number of old patients that you have. OPD चाहे आपकी मेरे से ज़्यादा हो, I'm not debating about that. I'm talking of the old number of patients that I have been treating or I have treated in the past 22 years. So always think more on your old retentive patients. They should have this mental security. मैं हूं ना, means dentist है ना, my dentist is there for me. Just a reassurance, just a smile, just a pat on the back, just a tap on the shoulder is good enough for the patient to understand that you are there. Ignoring is a very, very heinous crime in healthcare. Remember, everybody has the option. एक बार, 2 बार, 3 बार तंग करोगे, उसके बाद आसपास आपके बहुत सारे डेंटिस्ट, और कंज्यूमर कोर्ट तो है ही है, no doubt about it. Then the fourth matter was the seal of the commission and the copy not served. And my lord is fine. You can say my lord. They're so fan of these things, and the lawyers use these matters. The seal of the commission, probably what it refers is that probably it was not on the prescription pad, probably it did not carry the stamp of the clinic. And whenever you file a reply, a duplicate copy has to be served to the opposite party. You have to apply to the court sometimes with 3 copies. One you should have in hand, one goes to the judge sahab, and the third goes to the opposite party. When you're in high court, in a DB, in a double bench, you need to have 4 copies. Sometimes even 5 copies, because DB will take 2, opposite party, sometimes your lawyer and his junior lawyer and you. Sometimes even 5 copies. So these are trivial matters, and milords are fine, you can say fond of this. They have trivial disregards. These can always be appealed against in the upper court. In this case, from a district court to a state commission in the limitation period. Time लगेगा, no doubt. पर जब पहले मौका मिला था, patient call कर रहा था, तो you can, of course, I'm not saying that the dentist is guilty, but sometimes we get that all one chance at least to resolve the complaint. My dad was fond of this statement, nip the evil in the bud. पहली situation में उसको दबा दो. दबाने वाला ये नहीं कि सिर्फ दबा दो पैसे की ताकत से, पावर से. जानते नहीं मैं कौन हूं टाइप नहीं करना आपने. It means resolving the complaint. Resolve the complaints in a jiffy, in a hurry. जितना आप करेंगे उतना आपकी रेपुटेशन बनेगी ट्रबल शूटर की. लेकिन हमारी पहले जल्दी होती है, we are in a hurry to start the treatment. लेकिन अब कोई फर्क नहीं, टाइम ही टाइम है, जितना मर्जी लो, डिस्ट्रिक्ट कोर्ट से स्टेट कमीशन में जाओ, अप्लाई करो, बेइज्जती जो होनी थी हो गई है. But whatever it is, there you can file the reply also, appeal against the order. Everything is allowed. You don't need to pay that also. But then if you are right or wrong, that will decide wherever you can say hold the matter. So we started from here. So whatever the 4 points were there, we discussed that. So these were the 4 factors that I discussed today. Of course, the first 2 in detail and the last 2 in brief. The thing is, if you remember, if you want to ask, what could have dentists done differently? The problem is we don't know the other side, unfortunately, in this case. The colleague may be actually right also. He may have been late in, you can say, submitting documents. He may have been late in calling back. The patient may have made multiple calls and call cut to show that call was not answered. People do all sorts of gimmicks, and they are guided by our honorable lawyers in this regard. Because for or against or lawyer ne to dono cases mein kamana. So you need to remember this thing. So the golden rules will still remain, the 5 of them. The communication part. Whatever you are doing in consent form, that has to be first conveyed. Or let's say, put it up, you have to communicate what the patient is here for. You have to talk, you have to consult. This is about the consultation. Then the documentation, the record keeping, findings, treatment advice, treatment suggested, or whatever investigation is done, document that. Then the communication of the documentation. Whatever you're going to take, you can say in the consent, you have to do that verbally first. Once it is done, as I said before, once you do the communication of that verbally, everything in the consent just becomes a procedural formality. It becomes number 4, documentation of communication. And then the preservation of documentation for minimum 3 years. That is what the Dental Council of India also states. The limitation period is 2 years. 2 years means कि case होने से, treatment होने से 2 साल तक patient can appeal. But honorable my lords can allow 1 year of extension as a grace, which is known as a limitation period. So 2 + 1 is equal to 3 is the absolute or the relative time, I would say. Maintain your records in your database for any patient. What they allow for 1 year is known as the condonation of delay beyond the limitation period. So why do dental patients may sue their dentists? Wrong and unpleasant outcomes. As I said, you have to be on the same page. You have to be wary. The patient should not have a surprise at the end. than being negligent during treatment or documentation. Auntie, आप चिंता ना करो, मैं बैठा हूं, मैं कर लूंगा सारा कुछ, चिंता ना करो. Having that God syndrome with you, a wrong thing to have. Then wrong tooth treatment. One of the factors. The patient, नहीं डॉक्टर ये दांत दर्द कर रहा था, आपने पीछे वाला कर दिया. Maybe you did the right tooth. Maybe you did the right tooth. I'm not saying you did a wrong tooth. It was a referred pain in this tooth, but you have to explain, communicate, document. The patient has been made aware. The patient came with the pain in the front third tooth. On investigations, the fifth tooth was found to be guilty, carious, decayed. The patient was shown the X-ray and the audiovisual aids and was explained the same. And the patient agreed upon to the same that yes, his fifth tooth is the problematic tooth and not the third one for which he has come with the complaint. This comes in the patient for diagnosis and findings in the consent, in the top part of the consent form. This absolves you many a times because कई बारी क्या होता है करने के बाद भी रेफर्ड पेन यहाँ रहता है. माइंड में क्या आएगा, वो दांत तो मैंने पहले ही ठीक था, इन्होंने गलत कर दिया. I am going to court. And if you have a preoperative X-ray, sometimes a written consent will not also save you if it is a blanket kind of a thing. But you have a proper consent where it is documented in a manner that the patient knows, then you still can be safe. Of course, the consent-related issues. So these are the 4 factors. You can say these have been documented in the Forensic Legal Medicine Journal and book, I mean. So what is the carry home Gyaan for today? Think documentation, because it is your only defense. And documentation does not mean only record keeping on a software. It means consent also. And for one last time, consent is never fixed. It is always a customized form. मैंने अभी आपको example दिया number 5 tooth and number 3 tooth का. If it is my one fixed form, can the same be added in every patient? No. Then what is the solution? You customize it as per your patient. Have to spend some time. Never be in a hurry. Treat less, charge more, but do keeping your side safe first. Saving your own skin is the bottom line of today's session. It can only come via proper record keeping, documentation, and consent, of course. I hope you understand this. I have put you in the think mode. I hope so. So if not, if I've troubled you and disturbed your sleep, Japnam, my favorite web series Ashram. So thank you so much for a patient hearing. And this was the WhatsApp group I was talking of. If you want to be added, please do send me a message. I'll add you, or else once the sick group is full, I'll stop any additions after that. So these are purely advertisement free groups. My one way of giving back to the society, along with my lives in YouTube channel. So this is my YouTube channel. As on 15th March, more than 432 videos are already there on my channel. Go and subscribe and hit the bell icon. I keep on posting a video every alternate day. So do send me your feedback on my cell, on my group, on my page, wherever you're watching it. Bouquets and brickbats, both would be welcome equally. So thank you so much. And you can say I would stop my share to acknowledge the visitors on my page, and then we would take up any questions if there are. So thank you so much. So let me just, hi, Dr. Himit Karda. Hi, Dr. Swati. Hello, Dr. Ramchandra sir. Hello, Dr. Sonia. Hello, Dr. Rajinder Desai. Hello, Dhagash. Hello, Dr. Manu. Hello, Dr. Divya. Finally, you are here. Hello, Dr. Chetan. Hello, Dr. Vasudha. Hello, Dr. Asif. Hello, Dr. Vinita ma'am. Hello, Dr. Manoj. Hello, Dr. Parul. Hello, Dr. Kashif. Hello, Dr. Neeraj. Hello, Dr. Hina. Hello, Rajesh sir. Good evening. Hello, Dr. Sanjeev. Hello, Dr. Ale. Hi, good evening, Ale. Hello, Dr. Rajat. Thank you, Rajat. You have been giving wonderful inputs in the group. Always welcome. So thank you, Dr. Sonia. Thank you, Dr. Manali. Thank you, Dr. Rajinder. Thank you, Dr. Ramchandra. Thank you, Dr. Namita. So any questions? I'm here for 2 minutes. I'll take that up, or else we call it a day today. I know it was a long session today, but then this was intended intentionally for that reason. So I hope I've been able to add some value to your life. Okay, okay, Dr. Parul. Yes, Dr. Parul, the consent workshop was supposed to be held in the March end, but it'll be delayed by 15-20 days, probably in mid-April or around April. I'll be announcing that in the workshop. And the reason it is being delayed is because I'm actually combining two workshops into one. I'm combining consent plus record keeping in a single workshop. So that is the reason it is being delayed. So I'm working a little bit on a few things. So I already have the presentations, of course, but I'm just making correlation in the link between the two things. So that is the reason. Okay, thank you, Dr. Divya. So friends, that's it for today. Sorry for being a tad late today in starting and having a longer session today, but then this topic needed some in-depth. Of course, consent to 5 दिन बुलवा लो मेरे से, it will be less. So 5 full days, I mean. So that is the vastness of consent to make people understand what exactly its importance is in today's life. So, of course, thank you so much, and I do bid goodbye to all of you. Thank you. Bye bye. Take care.